Welcome to GNV On The Move, where we bring you the latest on the many programs, events, and initiatives that make our community unique. I'm your host, Jennifer Smart. Everyone knows Gainesville takes pride in being a tree city. Today we get to speak with City Arborist Dave Conser for a look at how we maintain and preserve those beautiful trees. We'll learn more about the Edible Groves Project, our Tree City USA designation, and the Tree Mitigation Fund, which helps replenish our urban forest. Today, we also get to watch Gainesville Fire Rescue teaching first responders how to save someone trapped in a submerged vehicle. But first, let's spend some time with Community Health Initiatives Director Brandy Stone. She is coming up with innovative ways to get health care to everyone, and not always where you'd expect to find it. Brandy Stone joined the city of Gainesville 4 years ago. She serves with Gainesville Fire Rescue as the director of our city's Community Health Division. She's focused on making Gainesville healthier and safer through collaborative work with everyone from professors to first responders to kids. Brandy, welcome to GNV On The Move.
Thanks, Jen, for having me. I'm excited to be here.
Yeah, so tell me a little bit about your history, what your training is, and how you ended up with Gainesville.
Sure. So I've been in Gainesville about 10 years now. I'm originally from Maryland and decided to make a big move to Florida to go to graduate school. And I was fortunate to attend the University of Florida for my Master of Public Health program. I graduated a couple years ago, probably more than a couple at this point, and decided to stay in Gainesville. I was fortunate to get a role with the University of Florida College of Medicine right after graduation, and then moved to student affairs, where I did health promotion and health education for students in sorority and fraternity life on campus. After that, I took a role at the city in the Department of Strategic Initiatives, where I supported strategic planning and collaborative partnerships with entities across the city, and stepped into the role with GFR as the Community Health Director in 2022.
And so I got here in 2022 around the same time. And I remember you were one of the first people I met because you were reaching out to all of the departments and making connections with everybody across the city so we would all understand more about what you were doing and how we could be connected to it.
Yes, and that was a really eye-opening experience for me because I wanted to understand what the city was already doing in this space and how I can support those efforts as opposed to duplicating them or, stepping on anyone's toes. But when I stepped into the role, and a big part of my role at the time was implementing our Community Health Improvement Plan, which is a survey that the Gainesville Fire Rescue Department did in 2021 to better understand the health needs of our neighbors across Gainesville. And from that, we identified a number of objectives and priority areas to focus that work. And a lot of that work was more than just what the fire department could do. It entailed partnership and collaboration from city departments. And I wanted to understand what we're already doing and how I can support that work to align with the city's health improvement plan.
And so you've done that brilliantly for, the past 3 years. And I don't know that people are even aware that we have a community health director in the city of Gainesville. It's a kind of a unique and an innovative approach that we're taking here.
It is. And based on what I know from other municipalities and areas, across the state and across the country, we're one of the few cities that does have a position like this, especially across the state of Florida. Public health is really overseen at the county level, and we do have great public health entities that work on, countywide initiatives, but the city has chosen to focus on our city of Gainesville residents with this role as well.
So there you are, embedded with Gainesville Fire Rescue. Tell me a little bit about what you do. What's your day-to-day work like? And also sort of what are those larger initiatives that you're spearheading for the city?
Sure. So one of the biggest parts of my role is oversight of the Community Resource Paramedicine Program. That program's a long-standing initiative out of Gainesville Fire Rescue, about 11 years now. And I really consider it as kind of the city's foundation in public health because it's how all this work kind of catalyzed and started. But the Community Resource Paramedicine Program was designed to reduce 911 call volume by getting folks connected to better health and social resources that can support their long-term health outcomes. So we get a lot of referrals from our GFR operational crews, the folks that are responding to those 911 calls, saying that, this individual that we went to a call for really needs help with food or really needs to understand their health condition or isn't connected to a primary care doctor. And so our team will then come in and help navigate other social and health resources to get those folks connected to the best resource for them. And we walk alongside people. We don't, tell them that this is what we think they need. We ask them what their health goals are, and we do what we can to help them reach those.
And I've seen you do this. I've seen you out in the community when you have been with this unit, because there's a lot of face-to-face outreach. There's a lot of person-to-person contact. And also, even as a communications office, sometimes we learn about folks in the community and then we refer them to you, and you go out there. So what does that look like?
Yeah, I mean, a lot of it can look like our community resource paramedicine team going out. We also have a medication-assisted treatment team that I'm sure we'll talk about a little later. But a lot of it is just understanding what the needs of the community are and trying to respond to them the best way we can, whether it's a resource the city has or whether we know of community partners that might have that resource. So I do attend a lot of community meetings, a lot of collaborative groups that are working on health and social issues. And so by attending those and getting to know folks that work in these spaces, I want to be a connector and be able to point people in the right direction when those resources come. But a lot of it is just listening to what folks say they need, looking at data that we have available to us, and making sure that what we're doing out in the community is responsive to what we're hearing.
And I think, too, before we get to medically assisted treatment, one of the things that has been really helpful as a communications team is having you on board to kind of help us shape the messaging that we want to put out there, the language we want to put out there, and the way we frame these issues that people are dealing with, because these are real human people in our community.
Yeah, absolutely.
And we want to make sure that we're discussing these really complex matters in a way that's always compassionate and putting people first. And you are so reliable in guiding us with that.
Thank you.
So tell me a little bit about where that comes from. Is that training? Is that intuitive for you?
So I would say it's a little bit of both. A lot of work in public health focuses on being trauma-informed and person-centered. And that really helps to inform the way that we communicate with folks and about folks. So using language like an individual with a mental health condition as opposed to a mental health person, because we are all people at the core of it, and those things can be used as adjectives as opposed to kind of representing our whole being. So using person-centered language is a big piece of that, but also being trauma-informed. And that basically means taking into account that we all have stories and pasts that have led us to where we are, and that often includes trauma for a lot of folks, whether it be poverty, violence, abuse, neglect, whatever it might be, that all of those things impact how we show up every day, no matter if it's as a community member in our jobs, with community organizations, and how do we make sure that what we're saying and what we're communicating is respectful of those backgrounds that people are coming to us with. So that's kind of the lens I look at it from. But I also look for what we call like a second or third order consequence. If we do this, then what are the trickle down effects that this could have on people's health and well-being? And I try to kind of keep that in perspective as we're rolling new things out.
And so when you talk about something, that's a great answer, by the way, medically assisted treatment. So this is one of those things where you are helping a lot of people. And it's something that people in the community may not be aware that we're doing.
Yeah.
Explain a little bit about this.
Sure. And I like to say our medication-assisted treatment program is kind of CRP's cousin, because they function in a very similar way, but with a much more narrow focus. So medication-assisted treatment is a mobile unit that we operate out of Gainesville Fire Rescue. It's staffed by EMTs and paramedics. And what that team does is reach out to individuals struggling with opioid use disorder to get them connected to a medication called Suboxone that can minimize their withdrawal symptoms and their cravings. And then we help them facilitate into long-term care options. So we're a bridge program. We don't see folks for months or weeks at a time. We can, but our end goal is really to get folks from our program into a long-term care provider where they can get more of those wraparound services, mental health treatment, any of those other services they might need. And our program operates 7 days a week. So we see patients every day, 365 days a year, and it is free for anyone coming to us with that need.
And how is that program funded?
So that program is funded through the Florida CORE initiative. CORE stands for Coordinated Opioid Recovery Effort. That's being led out of the Department of Children and Families across the state of Florida. We found out this year that Alachua County was getting the CORE network efforts coming to our county. So we've worked with Alachua County Fire Rescue, Alachua County, Meridian Healthcare, UF Health, HCA Healthcare to kind of coordinate our efforts around how we're responding to individuals struggling with substance use and moving them from a 911 call or an active overdose into long-term care, and making sure no one falls through the cracks in that system.
And if people are interested in that program, how do they get in touch with somebody?
So our medication-assisted treatment program has staff that can be reached directly. If they have questions in general about what the program is, I'm always happy to take those. If they have someone they might think is a good fit for the program, they can call our staff and talk to them directly to see if they might be eligible.
And that would be at GFR?
Yes.
Okay, that's really, really good to know. And you also, I know, wanted to talk a little bit about the opioid abatement funds and those efforts.
Yes, and that's really tied into a lot of the work that our MAP program is doing. So the city is receiving opioid abatement settlement funds from the state of Florida as a result of a large lawsuit against big pharma, if you will, and the role that those entities played in overmarketing and encouraging overprescribing of opioids over the last couple decades. And so we're fortunate to be receiving funds that have a variety of uses that they can be, implemented towards, but all of it has to be geared towards prevention and intervention around substance use. And so we have been trying to monitor the needs of the community and implement our funds based on what we see. And we're doing, I think, a lot of really exciting things with that funding. One of the things that we have coming down the pike is a public information and education campaign around substance use, what it can look like, what substances in our community look like, and how to identify an overdose and get someone help. So we're working on developing that. We hope it'll be out in the new year, and are excited to launch that. And that has been a project that we've worked with UF, the College of Public Health assisted with that. And we've had a lot of community partners at the table to give input as to what that messaging should look like. To your earlier question, to make sure that it's, relevant to the community and the folks that we're trying to reach. So that's one of the efforts. We also are working to streamline transportation. Transportation continues to be a challenge for folks in our community. So we're working with a local nonprofit to provide transportation to get folks to and from mental health and substance use treatment appointments. And we're working with a group that's serving individuals who are currently incarcerated or recently released from incarceration. As we know, they're at high risk of experiencing overdose, and how do we, provide them education and tools to reduce that risk?
So you're weaving together a really impressive safety net of support services for people.
That's exactly the goal. When we look at things from a public health perspective, there's kind of three levels. There's prevention, there's intervention, and there's a tertiary level, which is folks who have already been impacted by the issue, but how do we make sure they're not further impacted? And so our efforts span prevention with our education campaign, that intervention with our medication-assisted treatment program, and with the contract with individuals currently incarcerated or recently returning to our community, and then also the folks who are in recovery, and how do we support them to continue on that journey? Yeah,
it's a fascinating program, and all of the work, it seems so intensive and so well informed. So before we wrap, is there anything else that you would want us to know about what you are doing or your colleagues?
I'd just like to plug some of the regular trainings and events that we have that are free and open to the community. So we have Gainesville Fire Rescue Healthy Afternoons, which is free and open to the public around different health topics. We move around the city so that we're reaching families in different pockets of our community. But if you follow Gainesville Fire Rescue on Facebook, you'll see all of those events. We also host mental health first aid trainings in partnership with Meridian, and community safety days where folks can get trained in crisis intervention, stop the bleed, and Narcan. And all of that is available and open to the public. So we definitely want to equip our community with information and knowledge and tools to support each other around public health as well.
It is great work you're doing, and thank you.
Thanks so much, Jen. It's great to be here.
Thanks for being with us. After the break, we'll speak with City Arborist Dave Conser about his work promoting the benefits of trees, maintaining our urban forest, and conserving our heritage trees that make Gainesville a Tree City, USA. But first, a look at steps the city is taking to address issues facing communities across the country.
The Gainesville City Commission recently approved a contract for speed detection cameras in school zones. The schools chosen for this initiative are Lincoln Middle School and Talbot Elementary School. Installation of the school zone cameras at these two schools is expected to take 3 months, followed by an educational period by Gainesville Police in the spring of 2026 before actual enforcement begins. October is a peak month for hurricane season and a great time to check the supplies in your emergency preparedness kit. Have your household batteries expired or is your sunscreen out of date? In Florida, you can replace them tax-free. You also won't pay sales tax in the future on fire extinguishers, portable generators, insect repellent, smoke detectors, or carbon monoxide alarms, among other items. Visit floridadisaster.org to find the list of preparedness supplies that are now permanently exempt from sales tax and stock up. Recently, the Gainesville City Commission approved a 3-year extension to the agreement between the city and Bright Community Trust. Bright develops permanently affordable homes in Gainesville on surplus lots previously owned by the city. Under the Community Land Trust model, the homes remain permanently affordable. Bright retains ownership of the land, while current and future sales of the homes are restricted to income-qualified buyers. The Community Land Trust program is part of the city's comprehensive housing strategy to increase the supply of affordable housing through new construction. The City of Gainesville Department of Parks, Recreation, and Cultural Affairs invites all neighbors to download the new Fall-Winter Seasonal Guide. The guide lists programs, camps, classes, and events offered by the city at its many parks, recreational centers, pools, or athletic fields. Visit the city's website and search Park Guide to download a copy of this valuable resource today.
Join us at the 44th Annual Downtown Festival and Art Show, November 15th and 16th in downtown Gainesville. North Florida's largest street festival features 200 artists, 3 stages of live music and dance, kids' activities, and food trucks with international cuisine. Learn more at GainesvilleDowntownArtFest.net, funded in part by Visit Gainesville, Alachua County.
City Arborist Dave Conser previously served with the Florida Forest Service. He has spent his career making sure our trees are healthy and ecologically diverse, whether on a span of thousands of acres or in your own backyard. Dave, welcome to GNV On The Move.
Thank you. Glad to be here.
I think what I want to ask you first is about tree culture generally in Gainesville. Gainesville is more devoted to its trees, and people rally around trees with more fervor and enthusiasm than almost anywhere that I have been.
Oh yeah, it is truly a Tree City USA. There are many other Tree City USAs, but we are really famously known for that, and people really do love their trees here in Gainesville. It's just amazing how people love trees. We've been a Tree City USA now for 43 years, and you hear people talking about that all the time. There is a definite passion in Gainesville. In fact, we have a higher canopy percentage, a cover of trees, than any other decent-sized city in all of Florida. So we really are a special place.
And we were just talking before this interview, you were mentioning that it even affects sort of our sense of space and our skyline because we're so enveloped by trees here.
Oh yeah, my father-in-law would come to town from Clearwater and go, "It's so green here. It's just so green," you know. People really do appreciate that.
So tell me a little bit about your work as city arborist. What do you do, and what is this job like?
Yeah, so our city urban forestry division, which I take care of, we're in charge of the city trees, and also for helping folks within the city of Gainesville manage the tree canopy. We are losing tree canopy naturally just because of development, and we're doing everything we can to preserve, promote, and enhance and maintain our tree canopy. So we kind of have a mandate of planting trees, protecting trees, managing trees, educating folks, and then collaborating with, partners with the tree management. That we're trying to take care of the urban forest, and we've come to understand that the urban forest is more than just the trees. It's the bushes, the ground cover, the wildflowers. We have become a Bee City USA because not only are we promoting the trees, but we're promoting the whole urban forestry ecosystem.
So let's talk preserving trees first, because we have heritage trees. These are very important. Explain to us what these are, what people's responsibilities are toward these trees, and how you protect them.
Yeah, that's very important. We want to protect trees. And so we have what we call heritage trees. These are trees that have achieved a really good size. Perhaps they're a high-quality tree species. And we want to say, hey, look, let's try and keep these trees as much as we can. So we do have some regulations. We do have a permitting process for removing trees. Developers, when they remove trees for a development, they pay into our tree mitigation fund so that as trees are removed, heritage trees or otherwise, we can replant trees or perhaps buy some properties that have a good urban forestry canopy already. But, if you have any doubt about what the rules might be about a tree, contact us. Contact the Urban Forestry Division. Look us up and check and see. All too often, almost all tree service companies are great, but there may be some fly-by-night folks that go around and say to a homeowner, hey, you don't need a permit to remove this tree. Well, that may not be true, so just check with us.
So that is something that people need to be aware of, that even though you own your property, there are some rules about what you can do when it comes to taking down your trees.
Correct. You know, if someone has a ginormous live oak tree on their property, that tree is benefiting all of Gainesville. I understand that's your tree, and it might seem sensible that I can do whatever I want with my tree, but that tree is doing thousands of dollars worth of benefit to all the citizens in Gainesville. You know, it's cooling things, it's providing shade, it's providing wildlife habitat, it's actually putting out oxygen we breathe, it's pulling in carbon dioxide, so hopefully reducing a greenhouse gas and climate change situation. It's reducing air pollution. That tree is actually pulling in air pollution. It's reducing stormwater that would normally be produced. That big tree might pull out 5,000 gallons of water every day. And so they've shown that the soils that are around trees will absorb 4 times as much water, stormwater, rainwater coming down. So it reduces that. People that are in hospitals and can look out and see trees, scientifically proven they'll get well sooner. Neighborhoods that are the same otherwise, that have more trees, have less crime. There's a whole bunch of benefits to your tree that go beyond your property line. So we just want to take care of our tree canopy and just, do the right thing.
I like that perspective. So it's almost like you're a steward of that tree rather than a person who owns the tree.
Right.
Yeah. And while we're talking about the good that these trees do, tell us a little bit about the edible groves, because this is a project that's just really fun and nice.
Sure. So we determined that we would like to plant some of our city park lands or city-owned properties into trees that would produce fruits and nuts. And we call these edible groves. You could call it a food forest. We've got 3 of them now. One at Smoky Bear Park, one at Fred Cone Park, and one off of Southwest 40th Boulevard where it turns off of Archer Road. And we call that Bountiful Boulevard. And so we have these places where our neighbors can go and pick fruit as they desire. There's be different times of year that, that fruit might be available and that sort of thing. But there's signage there and QR codes that you can look at and see, what am I looking at? What kind of trees are out here? That sort of thing. But that's a real good, feel-good project. We're just thinking about food insecurity and do what we can. And we'll plant more. And we have plans to plant more edible groves throughout the city of Gainesville.
So this shows how trees and nature are always environment on the minds of our city commission and our policymakers, and they're carrying out the will of the constituents. And clearly trees are very important to the people who live here. Tree Mitigation Fund fits into this category as well, because you mentioned not just protecting and preserving, but replacing. And that's partly what this is for.
Correct. So, for instance, when a developer clears some trees out of an area, they pay a certain amount of calculated money into the Tree Mitigation Fund. So we can replace those trees. We can replace that canopy. Or perhaps we can purchase some properties that are for sale that can become city-owned properties or parks, places where people can enjoy that canopy and preserve that canopy and replant trees where we can. And we've had some really great things happen with that Tree Mitigation Fund, where we are now, because of code changes, allowed to spend that money in some really unique and wonderful ways. For instance, we'll have special projects. There was an issue with the trees downtown near Harry's that were going to need to be cleared because they had problems with accessibility, handicap accessibility, drainage, trees tearing up pavers and causing trip and fall incidents. And we were able to rebuild that area and preserve those beautiful, iconic trees through the Tree Mitigation Fund. We're able to plant trees and vegetation now. We can not only just plant trees with that money, but we can replant Bee City USA pollinators, habitat. We can look at the whole urban forest ecosystem. We can plant trees on private property. We can provide trees to private folks for planting on their property through our tree sponsor program. You can look that up online, City of Gainesville Urban Forestry Tree Sponsor Program. But we can help you get trees on your property. We can prune trees properly. We can do all number of things that are great and help have fun. One of the biggest things we can do is those code changes have made it more easy for us to acquire properties for sale and preserve urban forest canopy that way.
Oh, very nice. And this is what I've seen you speak about sometimes in commission chambers, because our city commissioners have voted to purchase some properties for conservation lands. And this, I guess, is why.
Mm-hmm. Correct. Yeah. Sometimes those are parcels that are next to already owned city parks that, kind of join that park. There may be pocket parks that people can go enjoy. We've purchased some that have wonderful heritage trees and pollinator habitat on them. So this is a great way to permanently preserve and enhance those places. And we are looking at ways to continue to manage those properties where we even further enhance the tree canopies there. Maybe auxiliary plant some great species that will add to what's already there. We can get rid of invasives. That is a big problem in Gainesville. We do have non-native trees that are acting badly that we'd like to get rid of that really helps the rest of the urban forest to be super healthy. So we've got the abilities to take care of all that sort of thing through the Tree Mitigation Fund and acquiring properties.
And so last question briefly, because we're almost out of time. Tree maintenance, what tips do you have? And particularly since we're still in hurricane season, what are some of those safety tips for taking care of your trees?
Well, you should always be learning. And we've learned in urban forestry that taking out the interior branches of a tree actually hurt that tree for storm preparation. And so there's right ways and wrong ways to do that. And I would really highly recommend hiring a certified arborist tree service company that knows how to properly prune a tree to help it be more resilient. Trees that have been there for a while, we say that tree's been there for a long time. It's been like that for a while. Every tree has its issues over a long period of time, but we might be able to help that tree to be more resistant in those kind of cases.
Excellent. Dave, thank you so much for being with us.
Sure. Really appreciate it. Thank you. Thank you for the opportunity.
We hope you've enjoyed this glimpse of the many exciting projects going on in Gainesville. We leave you now with a look at GFR's Water Rescue Training Program, offered every year to our first responders. Join us again next month as we take another look at GNV On The Move.
The City of Gainesville's Dwight A. Tundra Pool draws neighbors every day seeking relief from the Florida heat. Recently, it also served as the training site for Gainesville Fire Rescue firefighters to practice water rescues. During the exercise, an initial rescuer enters the water wearing a self-contained breathing apparatus and brings the victim to the surface. The rescuer then signals the next responder to enter the water. Handing off the victim enables the first rescuer to resume the underwater search, while teammates on shore reel in the second responder and victim. Gainesville Fire Rescue does have a rescue team with specialized skills in swift water rescue, but they want to ensure that every first responder has been trained in water rescue.
There are certain procedures and very specific techniques that we use to maintain our safety and also the safety, and foremost, the safety of the citizens. And so consistent training on that will make us where we perform, flawlessly.
185 firefighters completed the training in August, and each year Gainesville Fire Rescue alternates submerged vehicle training with swimming and drowning rescue drills.